Well, today we got Kelsey coming in for care. We've been seeing her for quite a while. She does ballroom dancing. Then we also help her keep her migraines away. She was talking about how yesterday she was feeling a lot of maybe soreness, tightness, pressure up in the base of her skull, was getting a headache. We're going to see what got misaligned on her. That would be a subluxation that's causing interference to her nervous system. We want to remove that interference so her body can work the way it should. We're going to go through our protocol. Everything we do here is based on protocols, so we get a precise, accurate adjustment. We're going to go head to the left and then turn your head to the right. Head straight. We definitely have something up in the cervical spine. We're going to check the lower. Most of my patients, when they're dealing with migraines, a lot of times it's women, will often find a problem with their sacrum being subluxated. Sacrum's the bottom of her spine here. She's saying the left side feels off, something's not right in there. But I'm going to actually start with her sacrum. The sacrum's about the size of her fist. It should rock and move. That pumps spinal fluid up to the brain. It's also the bottom anchor of the spinal cord. So if this is subluxated, it's going to create havoc in her nervous system. This is one of the keys with someone who gets maybe headaches or migraines. We're using our integrator tool, very precise adjustment. This is one of the keys. A lot of doctors aren't going to think to look at the sacrum, but they're going to say, well, her symptoms are up in here. That's typically what the medical approach is. You got to look at the whole body. So I'll have you turn your head to the right, head straight. With chiropractic, we're always trying to get to the cause, understanding her body works as one unit, not just minimizing everything down to a set of symptoms and trying to treat the symptoms. As I press on her occipital bone, her breathing drops very low, her sacrum starts moving. So we're going to do a very precise adjustment up on the occipital bone here. She's probably going to feel her whole body start to relax after I do this. Her breathing's dropping low. I'm just going to hold this for a little bit. Just watching the breathing relax. We're going to do one more. That's going to get her whole spine reset. Head to the right. So that cleared out her neck. Give me a nice deep breath in. Let it all go. So we've got another area subluxated right up in the thoracic spine. This area, again, is another spot on migraine patients will find a lot. This is your fight or flight nervous system. We're in this little section of her upper spine, upper back. So if this is subluxated, this is communicating with the nerves and blood vessels that go up into the skull. These here can irritate and make the trigeminal nerve, which is up in here, more hypersensitive, which will then release chemicals that will cause headaches. Head to the left, then the right, right in the middle. All right, take a nice deep breath in. We got to do some more ribs now. We want her thoracic spine to have some more movement here. She's got some ribs that are fixated. We're going to get these moving. So these are just off their spine. Another deep breath in. There we go. It's moving a lot better. Another deep breath in. That looks way better.
I feel it in my sacrum when I breathe all the way in.
Feel stuck? What you mean?
Like, I just feel like tension when it gets to the...
All right. She's saying when she breathes really deep in, she's feeling it down in her sacrum. Check the lower ribs now. So another deep breath in. We got to get your lower ribs here. This is the lower rib cage. This is going to get her diaphragm to relax. Now a deep breath in. Is that easier?
Yeah.
So she said that felt better. Took tension out of the hip flexor, diaphragm, and her left SI joint. It's going to feel a little tender. One more deep breath in. We got her spine and nervous system totally reset. I'm going to let her just relax and take some breaths. We're going to be checking her feet and knees since she's likes being active.